2 months ago, 7:30 revealed the Queensland and Commonwealth governments were closing down tuberculosis clinics treating PNG nationals in the Torres Strait. The move's alarming TB specialists. They're worried a multi-drug resistant form of the disease will spread into northern Australia. 7:30 understands Australian authorities have now bowed to pressure and agreed to delay closing the clinics for another 3 months past the original end of June deadline. But as Peter McCutcheon reports, doctors are still concerned.
From his office in Cairns, respiratory specialist Dr Graham Simpson faces one of the biggest dilemmas of his career.
A couple of sleepless nights trying to work out what was for the best in the short term for the patients, and in the medium and long term for future patients and for the public health of Northern Australia.
Okay, chin on top, okay.
Dr Simpson has been asked to assist in the transfer of tuberculosis services from the Torres Strait to Papua New Guinea.
Good. Okay, Naomi.
And he said no, because he believes it's unethical.
And we really felt that the whole process was so doomed to failure that us doing that would provide a sort of cosmetic gloss to it, and give it a sort of spurious credibility.
The stance taken by Dr Simpson and his colleague Dr Steve Vincent highlights the risks the Australian and Queensland governments are taking in the decision to wind down all TB services to PNG nationals.
And to just cut them off cold turkey is cold-hearted. And quite frankly, it's irresponsible, it's criminal, because they will be responsible for deaths.
For the past 6 years, Queensland health doctors have been treating TB-infected PNG nationals on Australian soil, on Boigu and Saibai Islands in the outer Torres Strait. The PNG nationals live in the so-called treaty zone villages, sometimes only kilometres away from Australian clinics, but a long boat trip of many hours to the nearest PNG hospital on Daru Island.
Well, it's a nasty disease. You can't ignore TB.
The 7:30 report accompanied Dr Simpson and a Queensland health team to these TB clinics 3 years ago. They were focusing on a dangerous multi-drug resistant form of tuberculosis.
I know what's really happening on ground. To close that border, you actually it's like putting my hand and actually suffocating them.
And you've got those ones still to complete.
But this service costs millions of dollars, and late last year the Queensland, Commonwealth and PNG governments, as well as AusAid, began negotiations for an exit plan.
Now, I'm making this voucher out for $60.
It was agreed PNG should be given the resources to look after its own citizens, and these fortnightly clinics would be closed by the end of this month. But this plan was developed without consulting the Queensland doctors, who are presently treating 62 PNG nationals.
3 lots of tablets and the sachets, is that right? We're very concerned that PNG and Daru Hospital don't have the infrastructure, that they don't have the resources on the ground yet to get treatment to these patients.
Up until now, Queensland Health has gagged all its TB staff from talking to the media. But Dr Simpson only works part-time for the government and is prepared to speak to 7:30 as a medical specialist.
By imperiling adequate treatment of these patients and not identifying new patients and treating them appropriately, that will actually increase the level of drug resistance, and that will spread into Northern Australia.
The chest against here, chin on top.
I admire his stand, and he's right. I mean, at the end of the day, the medical people, you know, they commit their lives to saving lives. And for them to put them in a position where they know that this is going to cost lives is just a disgrace.
Local federal member and opposition whip Warren Ench says this is in effect a funding dispute between two levels of government.
They tell me it's about $18 million and the feds have been picking up $4 million. I mean, the feds should pick up the whole lot. There's no question about that, for goodness sake.
No one from the Queensland or Australian Health Departments or from AusAid would speak on camera to 7:30. But in a written statement, the Australian Department of Health and Ageing said the transition arrangements were appropriate.
The government's policy is consistent with the World Health Organisation's strategy for TB control, which advocates treating TB on a community-wide basis and not ad hoc services that are currently being supplied to PNG nationals who visit Queensland clinics.
That he must come to clinic.
AusAid is investing $43 million to help PNG improve health services across the country. And also in a written statement, an AusAid spokesman said,
treatment for TB is already available in Western Province, and these services will grow and improve over time as the rollout of support continues.
All right, you done?
Late last week, the Queensland and federal governments agreed to a change in plan. The clinics would continue on Saibai Island for 3 more months under PNG observation. Dr Simpson will be cooperating in the handing over of patient records, but he won't be travelling to PNG's Daru Hospital as requested. He says the whole transfer is rushed.
I don't think we've got any plan as yet as to what to do with new cases as they present. I don't think we've got a plan for what we do if this doesn't work.
Peter McCutcheon reporting.